Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest with us this week, Tammy Nadeau. She is a staff development nurse at Masonicare Health Center and also a staff nurse on 3 Ramage, one of our dementia units there. Welcome, Tammy, and thank you so much for joining us.
Thank you for having me.
It's an absolute pleasure. During the pandemic, you have volunteered twice to care for residents and patients in our COVID isolation unit. We can't thank you enough. What has this experience been like for you, personally and professionally?
It's been very eye-opening. We didn't expect anything like COVID to happen. So in the beginning, in general, everybody in the world wasn't prepared for anything like this. But I think that, we pulled it together. It was a learning curve along the way. And, I think it ended up with a good result in the end. We were able to provide care to a lot of patients in 2 different waves. Unfortunately, we did have some losses along the way. But I think overall it was a fairly positive experience as much as it could be for what it was.
And as I said, you volunteered not once but twice to be on these units and care for folks that were in, this very vulnerable state. And you weren't alone. I know you wanted to highlight some of your fellow coworkers.
So along the way, we had 2 waves of COVID at Masonic. The first one started in March of last year, 2020, and then that closed up July 2nd of 2020. And then the second wave hit in late September, early October, and carried over until February of this year. During both of those waves, there were 5 other employees, not including myself, that carried over and did both waves of COVID. So one of the other nurses, Sonam, myself, then the 4 aides that did both waves were Beth, Mary, Matt, and Victoria. And all of us volunteered. And as soon as that we heard that there was a second wave, we automatically knew that we would be going back.
And I have to ask you, what is it in your heart that made you jump to do that, all of you?
I can't speak for my coworkers other than the sense, probably for them, a sense of obligation. They did it, they had the experience the first go around, so they knew what to expect going into the second wave, so they would be the logical choice to return. For me, it's just, my extensive healthcare experience in not just nursing, but in other areas, that makes me want to be involved in things like this, because I feel that I have a lot to, offer to people and a lot to learn from these situations that I can actually carry back into other areas of life.
Tammy, it's just simply amazing. And JP, tomorrow is Nurses Day and the kickoff to Nurses Week. Just the perfect time to honor the dedication and bravery of Tammy and the many nurses we're so blessed to have at Masonicare.
Just listening to Tammy speak about really the heart and wanting to take care of our residents is truly inspiring. And Tammy, I want to thank you and really everyone that was on those floors caring for really residents that were in such need in a really compressed time. And for you to volunteer to go on that floor and do what you did was truly amazing. And I want to thank you for all that you did. It's made a difference. And I think when you talk about garnering that experience and wanting to give it back to your coworkers and the profession is truly inspirational, because that's what makes us all better. And I can't tell you how proud I am of all of our staff for all that they've done. The nurses were truly heroes in everything that they did. And when we think about those 2 waves, those waves were extremely stressful, and they were probably one of the most stressful time in my career of being at Masonicare for 31 years. And as much as I've said this, the stress level was extremely high, but being proud and seeing what you all did was higher, because it was just truly an amazing time to watch that compassion, that care that you were all providing made such a difference. And I think every day our nurses make a difference to those that we serve and deliver on our promise. And though tomorrow is National Nurses Day, every day is National Nurses Day, because without you, we can't deliver on our promise. So thank you for all that you do, and allow Masonicare to be Masonicare strong.
Thank you. It was a pleasure to be there.
Absolutely, you are the true healthcare heroes. Dr. Schwartz, turning to current medical news, Pfizer came out with an update on an oral drug that the company is developing to treat COVID-19 symptoms. What is the latest information on that?
Well, Sandy, every time we do these shows, there's something new, and we're moving forward. And this actually is something very interesting to talk about. But first, let me echo JP's sentiments with Tammy. I worked with you in the COVID unit, and I know what it was like. I mean, it was, especially the second wave, when so many patients were in need of care, and the dedication you showed, and all the nurses. So I just want to echo JP's sentiments, and just applauding all your efforts, all your work, and and excited for Nurses Day tomorrow and Nurses Week. So let me just start by saying that, and then moving on to our discussion of COVID. So you're right, Sandy, there is some research being done now by Pfizer, and they started this research late in March, and they're looking at a pill that isn't a vaccine, but it's an antiviral agent, and they hope that it'll be, available to the public maybe by the end of the year. So I'm just going to read a couple of quotes. This first quote is actually from the Pfizer CEO, and his name is Albert Bourla. And what he said is, if all goes well and we implement the same speed that we are, and if regulators do the same, and they are, I hope that it will be available by the end of the year. So that's, really pretty exciting. And you may know at this point, you may have heard the words, or so many words we're learning, but remdesivir. And remember, remdesivir is an antiviral agent. What it does is it doesn't prevent you from getting the virus, but it helps treat the symptoms of the virus and hopefully make those symptoms less severe. But it's given what we call parenterally, like you need to get an injection. And you can't really take it at home. You need to be in a healthcare setting of some sort to be monitored when you get it. But this new pill that Pfizer's working on may, help to keep people at home while they're recovering and having a shorter recovery time from viral symptoms. So I'll just read another quote, and this is again from the CEO, who says, particular attention is on the oral because it provides several advantages. One of them is you don't need to go to the hospital to get the treatment, which is the case with all the injectables so far. You could get it at home, and that could be a game changer. So that's really the key in this research. And the other thing they see preliminarily, and again, they just started researching it, maybe a month ago, 6 weeks ago, is that it may be well effective against emerging variants as well. So I think the key to understand about this pill is it's something called a protease inhibitor. You ever hear the term protease inhibitor? You know what a protease inhibitor is? So protease is an enzyme, and the virus really needs this enzyme. It's like a critical enzyme for the virus to continue to replicate. So a protease inhibitor inhibits this enzyme, and thereby, affects the virus's ability to replicate. And protease enzyme inhibitors have been used in a lot of other viral research, such as HIV and hepatitis C, and they've shown very strong results. So I'm very encouraged by this kind of mechanism of action, and so they could big difference in hospital rates as well. So just on a slightly, very brief, slightly different note, there is a company actually that's working on an oral form of a vaccine, not an antiviral agent, but a form of a vaccine. I'll just read a little bit of what I read, but they haven't started yet, but they're planning maybe in the second quarter of 2021 to enter into clinical trials. So this is developed by a company called Oravax Medical, and they say it's a new joint venture of the Israeli-American company Oramed and the Indian company Primas Biotech. So, I think, like they say so many times, more to come on this, but I think that'll be interesting as we follow this along and give you updates as well. So now comes the key point of the program for me, the inspirational quote of the week. And this one says, "Let everyone sweep in front of his own door, and the whole world will be clean." And that was written by a German writer, Johann Wolfgang von Goethe. And that was written about 200 years ago. But think about it, when you think about it, if everyone does sweep in front of his own door, meaning, continue to use good infection control practices, avoiding large crowds, hand washing, and still social distancing, we continue to improve and move forward. And look how far we are now compared to a year ago. So things really are moving along well. And I really do, again, want to honor Tammy and all the nurses for all their hard work, as well as everyone working at Masonicare. Thanks for your dedication, and again, wish you health and peace. Thank you.
Thank you so much, Dr. Schwartz, as always. I want to thank all of you for sharing your time and insights with us today. And thank you for joining us at home. Until we see you next time, we hope you'll stay safe and stay well. And we wish you a very happy Nurses Week. Take care.